Coverage of the 28th annual meeting of the ASMBS is brought to you by Bariatric Advantage, the most complete line of micronutrient replacements specifically designed for the weight loss surgery patient. Click on this ad to order yours today.
Hi, this is Tony with BariatricTV. I am here with Dr. Nguyen, and you just released a study here on the 6
factors predictive of in-hospital mortality in patient undergoing bariatric surgery.
So what motivated you to do this study?
Well, it's important to understand what factors that predict mortality, because the mortality is a huge concern for us. And for a patient undergoing these type of a bariatric operation, so what we found in this particular study, that we found 6 factors can be predictive of higher risk for mortality. Those factors include patient with age greater than 60, Medicare patient, patient with diabetes, patient undergoing open operation, male patient, and also a patient undergoing gastric bypass comparison to other type of operation.
So, surprisingly, gender had something to do with that. Is there a reason why? Do you know?
It's actually very well known that male is a higher risk factor. So this is actually nothing new to us. It's been in the literature, and the reason for that most likely is male has central body habitus. So what we call it central obesity, meaning you carry most of your weight within the abdomen. And these patient tends to have higher comorbidities, including diabetes, hypertension, dyslipidemia.
So with the results that you've gotten from this study, do you see it affecting anything via the patient? I mean, do you think this will help to alleviate some of their fears, help to...
It does.
It does.
The first thing is that you can rest assured that the mortality has improved over the last decade significantly. We're talking about a 0.8% mortality in 2002. Now in 2009, you're talking about a 0.1 or less mortality. So to put that into perspective, that means 1 every 1,000 operation being done, there would be a death. That's a tenfold reduction in the death rate associated with these operations. Why? Well, there's a lot of factor involved. We developed the laparoscopic technique, which is, I think, improved significantly, and that has been shown with many benefits for the patient. And we developed the Center of Excellence program, which has really improved the care of bariatric patient.
So if you had anything to say to a bariatric patient that wanted to know more about your study and the results of it, what would you say to them?
Well, you can look at these risk factors and actually kind of understand what you're getting yourself into. I think that the most important thing is that you have to understand the risk you're taking when you're undergoing bariatric operation. But what we did is we kind of classify 4 categories of patients: class 1, 2, 3, and 4. Class 1 patient, according to these risk factors, has the lowest mortality, and then class 4 has the highest. So it's very simple. You just have to determine which category you are in, and then you kind of understand where you belong. But even with the highest category, which is class 4, the mortality was 0.7.
Right.
So even then, it's still less than 1%. So even if you're the highest risk patient, I think, and there are things that we can actually do as physicians to kind of mitigate some of this risk.
Right.
For example, diabetes was a factor. Well, we want your diabetes to be optimized prior to the surgery. We can't change the fact that your age is 62 or you're a male. However, we can change the fact that if you are older and you are higher risk, possibly we can alter the operation. Gastric sleeve and gastric banding has associated with less mortality compared to gastric bypass. So that's one way that you should approach your surgeon and says, what about the gastric banding or gastric bypass instead of the, gastric banding and gastric sleeve instead of the gastric bypass.
So basically, a well-educated patient has probably more, since they realize what these risks are. A well-educated patient will be able to choose the type of surgery that's probably best for them and their comorbidity.
Well, that's a conversation you got to have with your surgeon. That's very important to have that conversation, not just go blindly says, you know what, I want a gastric bypass. We don't do that these days anymore. And that's why we do these type of studies, so we can understand a little bit more what are the risk factor, you know, for someone who will die from this particular operation. I think we have a lot more knowledge now than we did a decade ago. So I think we have to utilize that knowledge to our advantage and for the patient benefit.
I agree. And thank you so much for doing this study. I think it's going to be very helpful to patients out there that are doing research into having gastric bypass, banding, VSG, sleeve, whatever. I think just the knowledge is going to help them be more reassured about having surgery.
Great.
Thank you.
You're welcome.